Okay, so last month we told you about Christina Poser. She's a mom of 3 from Hudson who had a tummy tuck at Bashioum Cosmetic surgery, and her mommy makeover results were pretty amazing.
Look at that. Well, this time we're talking about one area a lot of women are self-conscious about, and of course that's their breasts. And as TCL producer Kelly Hansen shows us, a Rogers mom couldn't be more confident in the enhancement she made to her body.
36-year-old Lisa Sheehy is getting used to her new body.
If you have to have any other surgery, there's going to be pain, but it's totally worth the outcome.
Less than 2 months ago, she was headed into the operating room for breast enlargement surgery, a procedure she's wanted for years. After having a baby and nursing for almost a year, Lisa didn't feel comfortable in her own skin.
Before having him, I was a full 34B. Like no padding, they were perky, they were, you know, they were good. I was fine with that size. After they went down from breastfeeding, they didn't fill in my 34B.
Well, many of the patients that we see for breast enlargement have gone through a pregnancy, and that pregnancy changes the breast. Typically, there are losses of fullness in the upper part of the breast, and many times the breasts are smaller than what the women were before.
Plastic surgeon Dr. Ralph Bashioum says Lisa can expect to have fullness back and may be a little bit larger than expected. Her hope is a full C.
Okay, so here's my before. This is a 34B, and it's a bombshell, Victoria's Secret. It's got lots of...
Very padded.
Very padded. It's supposed to give you 2 sizes. I don't know that it really did, but it gave you a lot. Here's the new one. It's a 34D. Absolutely no padding. It's lined.
Lisa says in a few months she should see the end result she's been waiting for, but is already surprised at how confident she feels.
They're still settling into place, but they look way better than even last month.
Many of the women that we see are even embarrassed to be uncovered in front of their husbands or their partner, and to see them get beyond that and to be comfortable in their own skin or in their own body is a real joy.
And Dr. Ralph Bashioum and also Lisa are here right now, and thank you for being here, first of all.
You're welcome.
Lisa, how you feeling?
Good.
Good?
Yeah.
Are you so far so good? You're liking everything?
I love them.
Yeah.
Okay, so a lot of women go through this, Dr. Bashioum. A lot of women are feeling self-conscious, and I kind of have the belief that if there is something that you're uncomfortable with and you can do something about it and you're in the position to do it, why not go for it? But I think we need to talk about the recovery, because that's the nervous part that people get, is that it's a surgery.
Absolutely.
And so tell us a little bit about the recovery process for Lisa.
Well, as a surgery, we have to respect that, and it's a real thing to get through. One of the philosophies in our office is that we want to reduce pain as much as possible. This comes out of the fact that I had my tonsils out when I was 4.5, and I remember that.
Really?
So we try to reduce the pain as much as possible. Many of our patients, women have had children in particular, say that it feels like their milk came in. And over half of our patients only take Tylenol for the surgery. So it's not a difficult thing to get through, by and large.
And Lisa, that was the deal. It was after the breastfeeding you talked about this. I like how Emily and I are holding these implants.
I know we should
here.
probably reference why we're doing this.
Yeah, we're holding them to see this is what actually goes in. And I mean, do you know that with a lot of your girlfriends, Lisa, that have kids, that you just feel like it just wasn't the same?
Yeah, I mean, they just go away. There's nothing left after breastfeeding. I don't know about not breastfeeding, but they're just gone.
Yeah. Okay, so tell us about these, Dr. Bashioum. What do we got here?
Well,
What's going on?
These are actually sizes that women try on, because the size is a very personal choice. It's one of the most personal things, really, of this whole process.
Yeah.
And as a result of that, they will try these sizers on. Now, these are silicone gel-filled sizers, like silicone gel-filled implants. And these are one of the choices for women.
Yeah.
But when given a choice, and when we talk about the differences in responsibility with regards to the implants, almost all of our patients pick saline filled rather than silicone gel.
Why?
Yeah, is there...
Because the maintenance on these and the risk of the minor inflammation you get when these rupture is always in the back of their mind in this day and age, what we know. And since they've been reapproved, the FDA actually recommends you have an MRI test every the 3rd year after surgery and every other year after that. And those sort of things add up. Saline implants, you have complete peace of mind. You never worry about them. And if they break, you don't have to do anything.
It doesn't matter, because the saline isn't going to do anything,
Okay.
unlike the silicone. But this feels like, I mean, Emily and I both picked these up and we're like, that's what it feels like.
It
Well,
feels
hello.
very natural.
And that's the wonderful thing about silicone gel implants, is that they do feel more natural. But when you weigh that against the not the headaches, but the concerns you have with the silicone gel,
Yeah.
Then you have to look at
So
that.
did you go with saline, Lisa?
I did saline,
You
and
had-
they still feel pretty natural.
Yeah.
Yeah.
Okay. Oh, go
Oh,
ahead.
and that's okay. I was just going to say, and obviously there's some more recovery and things are going to be changing a little bit because you probably have swelling and you know, they're going to go down a little bit. How are you feeling with that? And
I think they look great. So does my husband, of course. But
Well, we totally agree, Lisa. We do agree. But as far as the sizing goes, Dr. Bashioum, can you talk about that? Because I understand that there is a little bit of a quote-unquote settling time.
Yeah, well, anything that we do in surgery heals over a 6-month period. That's the way the body heals. And anybody who's had a little cut on their finger or their hand have noticed that it's red for about 6 months. Okay. That's the healing process we're talking about. And over that period of time, the breast takes on a more natural physical appearance, and it's just a natural healing process.
And I think a lot of women too, when they start thinking about sizes and what they're going to do, the types, the sizes, it's overwhelming. And I'm sure that some women are really worried about picking a size that's A, too big, or B, too small.
Yeah.
You know, unfortunately, we're not like the designer that was on. Can't narrow them down because it's such a personal choice.
Yeah.
So we have one of the nurses help them. I don't get involved because my opinion carries too much weight. So we let them try on implants, and it's shocking sometimes what people pick out, either small sizes or very large sizes. And you have to let people have that freedom because they're the only people that know what they were like, what their friends are like, what kind of clothes they want to wear, how they are.
So Lisa, how long did you think about doing this? How long did you think this is something I'm interested in?
pretty much since my son was a year old, and he is 9.5 right now.
Yeah.
So yeah, I wanted them for a while.
And then when you look back at the decision to do it and all that went along with it, are you happy that you decided to do it?
I wish I could have done it sooner.
Really?
Yeah.
Okay.
Yeah. And I'm sure a lot of women feel that way. I mean, there is something to that idea of having your body back, sort of, after having children.
Yeah, this is a reconstructive kind of surgery in a certain way, and you know there's certain things women can do with their body, lose weight, work out, and they can get some of their physique back. But something changes you just can't do, and this is one of them.
All right. Well, thanks so much for being here. Very
I know,
natural
this is
feeling.
so fascinating. This is very, very fascinating. And of course, you can call Bashioum Cosmetic Surgery Center to schedule your consultation today. We posted more information at TwinCitiesLive.com.
I feel like we could be on YouTube after holding these for the whole segment and just kind of
I know.
tossing them around. If it happens, whatever. Let's say thanks to Bashioum Cosmetic Surgery Center for sponsoring Twin Cities Live. Thanks so much for talking about it.